Thank you, Hannah. Again, Hannah will be back for the Q&A after our next speaker to address some of your comments. Now, all this strategy and psychology stuff is all very well, but as all professional facility managers know, everything we do has to comply with a few hundred rules and regulations, from employment law and waste regs to electrical testing and allergen controls. More important even than that is our role in keeping the workforce and those affected by their work healthy and safe. For those of us in the UK, the Health and Safety Executive provides first-class guidance and advice to help us to achieve that. Our next speaker is Operational Policy Advisor from the HSE, and he's going to give us some of that advice right now. Please welcome Mark Crossley.
Well, good morning, ladies and gentlemen. Thank you for inviting me today. I'm here today to talk about staying on the right side of the law, working safely to reduce the risk of COVID transmission when you return to the workplace. My name's Mark Crossley. I'm a policy advisor with HSE. I'm going to start with an update on the current restrictions that were correct at the time of recording this on the 7th of July, followed by a brief explanation of HSE's role and work during the pandemic, an outline of what the law says, and a brief discussion around the current key control measures to manage the risks when you return to the workplace, some of which may no longer be in place when you watch this, but there will be an opportunity to ask questions at the end or in the live Q&A feed during the talk. So at the time of recording, as we're aware, there's been an easing of restrictions, and the move to step 4 in England was delayed. It's now not expected until the 19th of July. We're obviously expecting a government announcement on the 12th of July. So please factor in throughout this presentation that the government guidance may have changed between the time of recording and the day that you're viewing it. But this is a perfect illustration of the rapidly evolving nature of guidance in the COVID policy world, and as we respond to new information and insight. It's important to note, of course, there are different timetables in Scotland and Wales. So it's important that all businesses continue to follow the government advice on gov.uk and on the Scottish and Welsh equivalents. Also, be aware, please, of any local restrictions that may be in place, especially around any new variants that might be circulating. The UK government advice on the 19th of July is that no longer requiring people to work from home if possible. This is obviously a big change from where we've been over the last few months. We understand that gov.uk pages will be updated soon to recognise that the requirement for social distancing will no longer be mandatory in England, although we expect that Wales and Scotland will follow suit. Our own guidance pages also remain to be updated on HSE's website, but for now, the main workplace controls remain unchanged, which is the importance of having adequate ventilation, frequent cleaning, and good hand hygiene. So the hands and the face and the fresh air still remain, but the space element is probably going to go. So businesses should still continue to do risk assessment of COVID-19 and consider these control measures, and just watch this space for the latest developments. So workplaces should continue to complete a COVID risk assessment and keep this under review as things change. It is possible that the requirement to do a specific COVID risk assessment may be removed in the guidance. If that is the case, obviously that doesn't affect the requirements of the General Health and Safety Law to do a risk assessment. So a key message I want to get across today is the importance of staying up to date with all the relevant guidance, not just on HSE's web pages, but in the Working Safely guidance on gov.uk. There's different guidance in England, Scotland and Wales. Now, HSE has been consulted on this guidance that was developed by BEIS, the Business, Energy and Industrial Strategy Department. And that covers specific industry guidance, for example, on close contact services, like hairdressers, beauticians, as well as things like offices, contact centres, factories, construction, you name it, there's an industry guidance for it. So I'd certainly point in the direction of that, because although we don't own the guidance, we do use this to determine what is reasonably practicable in terms of the application of health and safety law. So please keep up to date with those links on our website there. And just lastly, obviously, I'll shameless plug for our own HSE pages. The latest news and guidance on health and safety can be found at that link at the bottom there for HSE guidance. So moving swiftly on, very briefly, just an outline of our role. HSE is obviously the GB-wide regulator of workplace health and safety. Throughout the pandemic, we've been carrying out spot checks and inspections to check workplaces are following the government advice that I just referred to. And where we identify issues of concern, our actions can involve providing specific advice. We can stop work practices until they're made safe. We can issue enforcement notices, or in extreme cases, prosecute where a business fails to comply. In addition to that, we also do partnership work with other agencies like Public Health England and the devolved equivalents in Wales and Scotland, and work together with local health protection teams to deal with responses to outbreaks. We also follow up reported concerns and incidents that fall into our selection criteria. But we don't do everything to do with the pandemic. Some areas that fall outside the scope of HSE include anything to do with vaccinations, workplace testing, the test, track and trace system. There's a mass asymptomatic testing program in education, which also falls outside of our remit, and anything to do with face coverings. Face coverings are a public health protection measure, largely intended to help protect others rather than the wearer. For that reason, they're not classified as personal protective equipment and therefore not covered by health and safety law. So if anyone has any queries, because I'm conscious the guidance has very recently changed about the legal requirements to wear face coverings in certain settings, then please refer to the latest government advice in your area. And for specific advice on when and how to get the vaccines at work and testing staff, there is advice from ACAS, the Advisory and Conciliatory Arbitration Service, who can provide further information if needed. So moving swiftly on, the law requires that employers take all reasonably practical steps to reduce risk to their employees, as well as reducing risk to non-workers under Section 3. And as I said earlier, what's defined as reasonably practical in terms of COVID is in what's defined in the government guidance. So again, refer you to the Working Safely guidance. There's also legal duties to carry out a risk assessment under the management regs, as well as underpinning regulations for workplace health and safety or display screen equipment, personal protective equipment, and hazardous substances. The health protection coronavirus regulations, which place specific duties on business closures, self-isolation, the need to wear face coverings, are obviously a key piece of legislation, but these are not health HSE enforced. These are public health legislation enforced by the devolved public health agencies. So the most important requirement as we return to the workplace is obviously to carry out a specific risk assessment. Again, the requirement to carry out a specific COVID risk assessment may be subject to change, so please check the latest guidance. But the management regulation requirement remains in place. And when completing a risk assessment, please make sure you talk to your workers and their representatives to explain the measures you're taking and to get their feedback. And as part of the risk assessment, you need to make sure that you identify those activities or situations that may cause transmission of the virus. And think about who could be at risk if you have any vulnerable staff or clinically extremely vulnerable staff, as well as those people working in close proximity to others. You need to decide how likely it is that people can be exposed, as well as acting to remove the situation if possible, or if not, to introduce control measures to control the risk. And a key point running through my presentation today is the importance of monitoring and reviewing your control measures to make sure that they are working adequately. Another key point is that risk assessment is not about paperwork. It's not about generating reams and reams of paper in a file that people don't read. It is about controls, and the focus should be on the controls and how well they actually work in practice, not how well they work on paper. But further information is provided on the link at the bottom of the page there. There's a risk assessment template on HSE's website, which I certainly recommend. Although again, the focus is not on cut and pasting a template, but making it specific to your work setting. So social distancing, I have produced some very interesting slides on social distancing, but obviously the recent government announcement just a few days ago is that in England, at least, the requirement to social distance will be removed from the 19th of July. And although it will no longer be mandated by law, it will likely still be advisory, and some employers may still choose to follow those guidance. This position remains in place in Scotland and Wales for now in terms of social distancing, although we are expecting decisions in the coming weeks. So again, please stay up to date with the relevant government guidance. But for now, businesses should continue to conduct a risk assessment of COVID-19 and consider your control measures, including ventilation, cleaning and hand washing. I'll move on to those briefly soon. But also, these measures for social distancing could now be optional. So things like one-way systems, screens, avoiding face-to-face seating, limits on numbers within office spaces and other workplaces. These may all be options available to employers, but they'll no longer be required under law. But if you do introduce these measures, then you just need to ensure that you have arrangements to monitor and supervise they're being followed and provide the necessary information, instruction and training, as well as signage if required. Talking about the importance of cleaning and hygiene and hand washing, obviously we know this is a key control measure and that's unlikely to change in current guidance. So you need to ensure that your workers, as well as any customers or visitors and contractors who are in your workplace, have access to adequate hand washing facilities. That's already a requirement in workplace health and safety law now, as well as having running water, soap and paper or hand dryers. And you need to provide information in terms of how to wash your hands properly, if required, and ensure you have systems in place to replenish your hand washing and sanitizing facilities. As part of your risk assessment, you need to decide how many washing facilities you need and where they should be located. And also where you can't have people washing their hands, so at entry or exit points to your premises, or where you have delivery drivers, then you should consider providing hand sanitizer. And again, there's already a legal duty to provide welfare facilities for visiting drivers under the workplace regs, and the importance of monitoring and supervision, again, to make sure these are working in practice. It's a good practice to have a cleaning plan that specifies the frequency and level of cleaning, what needs to be cleaned, who should do it and how, what products should they use. It's very important that people know how those products are meant to be used, so please check the manufacturer's instructions. It's also important as part of your risk assessment to identify those frequently touched surfaces like door handles, banisters, buttons and switches, particularly lift buttons that need to be frequently cleaned. And where you can't, if it's not practical to clean after every use, such as lift buttons, just make sure they're cleaned as often as you can. In order to facilitate cleaning, and by keeping your workstations clear and other work surfaces, that can make the job easier as well for your cleaning staff. And it's important to have clear guidance on higher risk areas like the use and cleaning of toilets, showers and changing facilities where the risk of transmission could be higher. If you have shared workspaces or equipment, or where you have shared tools or vehicles, it's important obviously to keep those cleaned between uses. Moving swiftly on, a key control measure going forward, it may well become the main control measure as we enter the autumn, is ventilation and air conditioning. There's already a legal duty to ensure an adequate supply of fresh air in enclosed areas. We know the risk from transmission is greater where there's poor ventilation. And this can be done very simply by maximising fresh air through natural ventilation, by opening windows and doors. Check if you've got air vents that they're open and unobstructed. And if you have a mechanical ventilation system like air conditioning, make sure that's in full functioning order and that it uses fresh air drawn from outside, not recirculating air. That is a key point, that the air has to come in from outside. Obviously consult engineers if you need to, and make sure that your air conditioning systems, if you have any, are maintained in line with the manufacturer's instructions. As part of your risk assessment, to identify those poorly ventilated areas, carbon dioxide monitors is one useful tool that can be used. It's not a control measure in itself, but it's certainly a very helpful way of identifying where you may have higher risk. So consider how large the workspace is. Larger areas generally are better ventilated. And also what types of tasks and activities take place in the area. So if you have activities that make you breathe more deeply, for example, physical exertion or singing or shouting, then these can obviously increase the risks of aerosols. So you need to make sure you've got adequate ventilation. If you use desk or ceiling fans, just make sure that they draw the air away from people, not directing air into people's faces, therefore increasing the risk or affecting the flow of natural ventilation. And likewise, if you have large machinery in the workplace or any other features that might affect the free movement of air, that should be another factor that you consider. If that creates stagnant pockets of air, then obviously you need to increase the ventilation to accommodate. If you have a local exhaust ventilation coming into the machinery workshops, then you need to check that they're fully functioning and also that they don't affect the natural ventilation systems. If you have complex ventilation systems, then you may need to speak to a qualified engineer. And just lastly, as we enter into the cold months, not for a while yet, hopefully, that you need to factor in considering thermal comfort of your staff. We know this is a key issue when all the windows and doors are open in the winter, and there is a requirement of the workplace regs for ensuring an acceptable working temperature, so please bear that in mind too. I'll wrap through this one quickly, but the important strand throughout this presentation is talking to your workers, providing information, consulting workers, and you can do that either directly through one-to-one conversations or team talks, or through speaking to their trade unions or other safety representatives. You need to consider the risk to vulnerable workers. So we know that old males, those with higher BMIs, with health conditions like diabetes, people from Black and minority ethnic background, and pregnant workers can be at high risk. So you need to consider that in your risk assessment. We don't expect specific controls for these workers, but the workplace should be safe for all staff. And it's important that your existing controls are applied strictly. Individualised risk assessments are not required under health and safety law. I know they are referenced in Scottish and Welsh guidance, but that's not a requirement that HSE requires in our guidance. And obviously the importance again of discussing your control measures with vulnerable workers is important. As we return to the workplace, there will be anxieties from people who fit that category. Likewise, those that fit the clinically extremely vulnerable category, during the initial stage of the pandemic, they are required to shield and work from home. However, that is subject to change. So again, stay up to date with the latest guidance on gov.uk. But where you have CEV workers who are required to work at home, and that is still the state of play at this point in time, then you need to have measures in place to facilitate home working, to make sure that's done safely, so ensure that they have the adequate IT, that you have measures in place to stay in touch, and think about other online resources to look after their health and well-being. Again, there are different rules in Scotland and Wales, so please be aware of the devolution element. And also, again, encouraging that ongoing discussions with workers and trade unions. Working from home is something we've all been doing an awful lot of. I'm obviously delivering this presentation from my living room. There is obviously the legal duty to ensure a safe workplace wherever you work, whether that is in the office or in a remote location or in the home, and that remains unchanged. Obviously, the main risks from home working are from DSE use, and DSE assessments will be required for habitual users. So anyone who uses display screen equipment as part of their normal work at home, even if it's just for a few days or week, if this is regarded as habitual use, you will be required to do a DSE assessment. There are online tools. It doesn't have to be a physical assessment from an assessor actually in the vicinity of the individual. And there is advice on our website on the home workers page there on how to do those. But consider other risks such as stress, mental health and well-being. And we know fatigue from working excessive hours. There's a drive at the moment for the right to switch off. So please be aware of your staff sensibilities at home as well. And the importance of staying in touch regularly, either through virtual team meetings, is an important factor too. Just a quick reminder there about the safe postures that you should be adopting. These are actually screenshots from our online tool. So I'd certainly recommend that on our home workers page. Just another reminder there about the importance of keeping your head level and the right posture when you're doing DSE work. Very lastly, as we come to the end, a few risks that are not specifically on COVID, Legionella risks. This is already a requirement in law now that if you have a water system that hasn't been used for a long time, where buildings have been closed or you have reduced occupancy, the stagnation of the water can lead to a build-up of Legionella bacteria, which can cause Legionnaire's disease. So please pay attention to your risk assessments, review them as required, especially when reinstating water systems or air conditioning units that haven't been used for a while. Make sure you flush any infrequently used hot and cold outlets, water outlets. And if you have cooling towers, condensers or air conditioning units, bar pools or hot tubs, again, make sure that those are kept clean and flushed out accordingly. And if you have any further advice, then obviously speak to a competent person or an engineer. There's further advice on our web pages at the links there. And just finally, stress is obviously a priority topic as we go through the pandemic. This has been a priority topic for HSE for many years. There will be a lot of anxiety as people return to the workplace, and we know from evidence that 800,000 plus workers in the year before the pandemic were suffering from stress, and this is attributable to 55% of all working days lost. So your risk assessment needs to consider their mental health and well-being as well, and look at the control measures that can affect stress levels, such as the work demands, the level of control, the support arrangements, and the relationships and the job roles. And obviously change can bring a lot of stress, and we've had an awful lot of that in the last 18 months. There's some tools on our website that can help you manage stress. The Talking Toolkit is an interactive tool for managers to help you have conversations with staff. The stress management standards is the approach that we recommend on our website for how to identify those key factors I just mentioned. We also have a mobile app, which is not specific on stress, but contains an awful lot of health and safety information for SMEs, which will be very useful, and our stress work pages as well. So that was a very whistle-stop tour. Thank you very much for listening to me, and there'll now be an opportunity to ask questions. Thank you.